How to get a medical marijuana card in Rhode Island. If you're in Rhode Island, medical marijuana has become legalized and more widely accepted. Despite this, obtaining a medical marijuana card can still be confusing and overwhelming. This video breaks down the steps to get your medical marijuana card in Rhode Island and all the essential information you need to know. The medical marijuana program in Rhode Island is a game changer for those seeking relief from specific medical conditions. It provides legal access to medical cannabis and ensures a safe and regulated environment for patients. But how do you get in? First, you must have a qualifying medical condition and a healthcare professional who certifies your eligibility for medical marijuana treatment. It requires a documented medical history to show the condition you're dealing with. Once you're eligible, you need to complete an application form. It includes personal information, identification documents, and a recent photograph. The best part? Rhode Island has waived the application fee. An essential part of the process is finding a medical marijuana doctor registered with Rhode Island's program. These doctors are vital in evaluating your medical condition and certifying your eligibility. Be ready to discuss your medical history and provide any relevant documents. Rhode Island also allows qualified patients to grow their cannabis for personal use, but it's crucial to follow all regulations. You can also access cannabis through compassion centers, providing a safe and regulated supply. The key to getting your medical marijuana card is having a qualifying condition. These include cancer, glaucoma, HIV, seizures, Alzheimer's disease-related agitation, and many more. You need documentation from your healthcare professional to verify your condition and certify your eligibility. You can also designate a primary caregiver, someone who assists you in obtaining and using medical marijuana. Your primary caregiver can be a family member, friend, or professional caregiver hired specifically for this purpose. Primary caregivers must be at least 21 years old and Rhode Island residents. They undergo background checks to ensure a clean record. To legally purchase and possess medical cannabis on behalf of the patient, caregivers must obtain a caregiver identification card. They must apply with the necessary supporting documents, including a copy of their valid Rhode Island driver's license or ID card, proof of residency, and a signed caregiver attestation form. Primary caregivers can only serve one patient at a time unless they are siblings, parents, or spouses. Furthermore, primary caregivers are not allowed to consume or possess medical cannabis for their personal use unless they qualify as medical marijuana patient themselves. Applying for a medical cannabis card in Rhode Island is a life-changing decision for individuals with qualifying conditions. The application process is straightforward. Start by determining your qualifying condition and consult a medical practitioner to evaluate your eligibility. Then, complete the online application form, provide all necessary documents, including a valid form of identification, and wait for the Rhode Island Department of Health to review your application. If approved, you'll receive your medical cannabis card, valid for 1 year. Remember, you must renew it annually by submitting a renewal application online. Getting a medical marijuana card in Rhode Island is a life-changing journey for individuals with qualifying conditions, and it's easier than you might think. But if you want to make the process even smoother, check out 11th State Consultations. We are dedicated to helping Rhode Island residents navigate through the process and ensure you have all the information you need. If you're ready to explore the therapeutic benefits of medical marijuana and improve your quality of life, reach out to 11th State Consultations at 401-228-5184.